My name is Dr. Soumya Muta. I scored rank 20 in this November INICET 2022. I did my MBBS from JIPMER Pondicherry. I'm a batch of 2K16. When I joined JIPMER for the first time, that's when I stayed far away from my parents, my family, and the language is also so different. Like it's Tamil and Telugu are different languages, but I felt it a bit similar and I felt it a little bit easier compared to my friends. And when I joined JIPMER, first year I had few subjects like academic subjects only, and I was good at academics at that time, and I did not enter into sports or anything. I focused on studies during my first and second years. I did not concentrate much on sports or any quizzes and all. I was introduced to quizzes by my seniors. I attended one quiz in biochemistry and I made it to semi-finals, and that time I felt very happy, and but I did not show much interest in quizzes at that time. So I was continuing my studies and extracurricular activities like badminton. I used to play whenever I am free. And then comes the third year. In third year, I spent most of the time in sports, like throw ball. I have focused. I gave more importance on sports and Spandan, that fest which we have conducted, rather than focusing more on studies. And in third year itself, my seniors introduced me to DAMS foundation course. At that time, the faculty, they taught me very well. Like the third year subject foundation course, the third year subjects they taught like PSM, ENT, Opthal. I felt very interesting in DAMS, and I had written my hand notes, and I was going through them in the meantime, like parallel to the subjects which I am studying at my college. And at that time, I did not I was attending, but I felt a bit stressful. Like after class, coming back to room and again going to DAMS, I felt a bit stressful. But now I find the DAMS foundation course is useful. If I hadn't attended at that time, I wouldn't have made notes of the third year subjects. In final year, I made my mind like I have to concentrate more on the studies, and I was like concentrating well in the clinical postings also. I'm very much interested to interact with the patients and learn from the patients. In postings, I did not miss even a single chance to appreciate a murmur or any clinical finding. I used to go to neurology and cardiology ward also in the evening to hear murmurs and to see more findings and to be confident about the findings and to pick them up very easily and very quickly. So I had focused more at that time in the clinical postings, but then comes the pandemic. During pandemic, like none of us expected that we will be coming back home, and that is not just for 1 or 2 months, and we had spent most of our final year at home, and there is no patient contact, and we couldn't elicit any findings and all. Whatever we learned through Zoom classes. Like whatever the teachers have taught, they have taught only theory part, and we also read theory. Like practical knowledge was not up to the mark. And when but one thing which I feel is okay, like which I was happy is I got to spend time with my family. From +1, +2, I started staying away from my family, and now when I got a chance to be with my family, I was happy at that moment, but I was compromised with my clinical skills also. When I went back to JIPMER to give my final exams, I had my friends around. We did group studies and we managed to clear our final exams. And then comes the internship. During internship, I thought like, okay, this time I had to focus on my entrance preparation. I opened my third year foundation notes. I tried studying in the first few months, but then I got a break. Like in the end of the internship, I had all the hectic postings like obs, gynae, medicine and surgery, so I couldn't read and all. I did not made notes for the first 2 year subjects, so I opened my textbooks, and I wouldn't recommend anyone to open textbooks for the entrance preparation. It is not much useful. And then I have finished my internship and I gave my first INICET exam on May 8th, and I got a rank of 15,000. I was a bit low, but I did not worry much about it because I know that I didn't prepare for my exam. I joined DAMS on May, and I stayed at hostel with my friends, and we all started attending classes, and we had excellent faculty at DAMS Hyderabad. Like, they made me realize and like some concepts which I hadn't learned from my MBBS, which I should have, but I did not. And those were taught by my DAMS faculty, and I felt so happy that okay, this is the reason behind this, and this is the reason behind this. I was satisfied with the content, and everyone used to tell me like, okay, very small content, is it sufficient for entrance exam? But that is more than enough, because it's not about the volume of the content, but it's the quality of the content. They did not miss even a single important topic or any concept. They did not miss. They had taught me the reasons behind this, like reasons behind each and every concept also. And they did not miss on the previous year papers and all. They included all the important topics, and that's what I read for my exam. And in between, like when Soumya sir came to DAMS Hyderabad, I was excited to meet him, and whatever like suggestions which sir gave me during the class, I followed them blindly. Like, I had no other thought in my mind that whatever sir said, I have to follow. Like, sir emphasized on doing the GTs, giving tests, and doing subject-wise tests, previous year papers and all. So I followed them blindly. Like, whatever sir said, I started doing them, and that helped me a lot in my preparation. Like, reading notes and doing and practicing tests, both are equally important. Like, the knowledge you gain from the notes, that is important, and you have to apply it in a very quick time. Like, in 200 questions I have to attempt in 180 minutes. That means I have to be focused from first question itself. So that I got from my practice sessions. Like, I started giving GTs on Wednesdays and Saturdays. I used to simulate the exam time, like 9 to 12 I used to give GT. And the GT review also I did not spend a lot of time on it. I used to give like 2 hours I used to give for GT review. First, I used to go through all the wrong answers so that I did not miss any single question. Then if I feel like I have to go through the concept behind it, I was confused and all, I used to go through that explanation of that particular question, and I used to move on. I focused more on revising the subjects rather than like giving so many GTs. I gave around 9 GTs before exam. In between, I used to pick a topic, like pick a subject, and I stressed more on the long subjects rather than short subjects. Long subjects, I used to give like 1 day for a subject. I used to go through all my notes and previous year papers in between. And whenever the GT day comes, I used to give a GT. I used to give 2 hours for GT review, and I moved on. And that helped me a lot. Soumya sir told like, give a GT on the day before exam, so it will be like a practice test for you. And the next day, same like how you have given the GT, you just go and write the exam and come back. That's what I did. I gave a GT on the day before exam. I gave a GT from 9 to 12. I reviewed that GT for around 1 hour, and I went through all the memory points like mug-up tables and memory stuff and all. I went through that, and on the day of exam, I did not revise anything on the day of exam. I had a good sleep, and I went to the exam and I came back. During exam also, I used to remember the points which were told by the sir in the class, like direct points, whatever sir has told that has come in the exam. I used to remember his face in the exam. That was happy when I remember like that. I used to be confident. Okay, this question I knew. So that confidence I had in the exam. When Soumya sir came to DAMS Hyderabad, we had a class test, and I scored highest marks in that. And sir gave that Yes I Can book, which was written by him, and I felt so happy at that time. I came to know like, okay, I can do it. And all my classes at DAMS are like interactive sessions. Like, I felt like it's like one-to-one. Like, whenever sir asks a question in the class, and I used to answer that, I used to feel happy about it, and that that interaction helped me focus more in the class. Like I had no thoughts in my class. Like I used to blindly listen to what sir used to say in the class, and whatever doubts I had cleared with them. I find it very easy. Like learning in the classroom is the best way. Then coming to the other, like pharmacology, I was scared of pharmacology because like so many names, everything is memory. It's very difficult to like read from textbook and all. But in DAMS Hyderabad, we had pharmacology class for around 4 days, and that is also from 9 to 9, like morning 9 a.m. to night 9 p.m. If I say this to someone, they would say, how did you attend? But that is actually very easy to attend. Like whole time I was interactive with the sir. Like whatever the sir was asking a question, I used to answer. I felt very interactive. I did not find it like too long, lengthy class and all. I find it easy. Like I had revised multiple times also pharmacology, and I was in like I got interest in that subject because of that sir itself. I had ENT class before INICET, like 1 month before INICET. So every one of us were like don't know like what's gonna happen, like are we prepared enough for the exam. But when sir came to Hyderabad and he was taking classes, in between that motivation which sir gave, that helped me a lot. I used to remember his lines like, you can do it, like you have to be focused, like go through your notes multiple times, revise your notes. That helped me a lot. I would like to suggest, like if you had not gone to the foundation course and you haven't made any notes in your like in the MBBS itself, then attending face to face is the best way to learn, and it's the easiest way to learn. And for my, like you can take my example, I had got 15K rank, and from that to 20, if I say this to someone, they would say impossible, but that I have done it in my case. So I would say learning from face to face, like directly interacting with the teacher, clearing your doubts, that's the best and the easiest way to learn. I did not make use of my foundation course much, so I would regret now, but okay, now I have scored a good rank, so I did not think, but I did not regret about it, but I had lost this 6 months time. But if you are preparing in your MBBS from foundation course, then make use of the eMedicoz app. Like they have all the pre-recorded videos. Make your own notes from that. That would help you achieve a great rank. For the upcoming NEETPG exam, I would suggest go through your notes which you have made in DAMS, like DAMS classes. Go through your notes multiple times. Keep giving GTs frequently, and before INICET for short subject, I was DVT like ophthalmology, and for Dermat I watched DVT. That helped me a lot. Like they will show all the important images, and you see from the previous NEET exam, like NEET which happened in May, all the questions, like all the image based questions were directly from the DAMS DVT. So you can score very well if you have gone through your DAMS DVT notes and giving GTs frequently. I would recommend DAMS for all the students who are preparing for the entrance test, because that's the best way to learn. Like you can't revise whole textbooks. Like you have already studied your textbooks during MBBS exam, but the approach towards entrance test should be like concise material and important material, like all the previous questions and all, and you have to revise it multiple times. If you are focusing more on I will revise my textbooks, if I will go through all my textbooks, my class notes during MBBS, that won't help you much. Like you may have same knowledge, like if you go through the concise notes, you can revise it multiple times, and revision is the key here. If you revise multiple times, then you can answer the question very quickly, and if you give GTs and all, you can answer the question very quickly. And DAMS I would recommend because the notes is very concise and the quality of the notes, and I would say like DAMS notes are gold standard. If you read those notes, make and that should be your handwritten notes. If you make your notes and give GTs, then you can score a very good rank.